Hi everyone, welcome back to another episode in the series Life in Canada. Today I'm going to explore healthcare in Canada. So is healthcare in Canada really free? Not really. It's actually funded by the taxpayers. Residents don't pay out of pocket for medical services. Who are residents? They are Canadian citizens and PR holders, permanent resident card holders. And in fact, temporary visitors, tourists, and most international students do not qualify for free healthcare. So they actually have to seek private insurance. Now, this being said, there are some international students who do qualify, and in their case, they have access to the free healthcare. So each province in Canada has its own healthcare management system, so coverage does vary. And if you relocate between provinces, you actually have to reapply for that particular province's health card. It's not transferable, you have to reapply. This being said, how do you get a health card? So to apply for a health card, you need to present proof of residency, which could be in the form of a utility bill, immigration documents, proving that you are a Canadian citizen or a PR card holder. Before applying, please look up the requirements, because some provinces actually require you to wait 3 months before applying. Without a health card, you have to pay out of pocket for doctor visits and hospital care. So what is covered under the healthcare management system in Canada? Basic medical services are free, so doctor visits, surgeries, hospital stays. However, prescription drugs are not included under most health plans, but there's exceptions for senior citizens, children, and low-income households. Dental care and vision care is also not included. So most people, what they do is that they get private insurance to cover their dental and vision care, which is obviously at an additional cost, right? So this being said, let's talk about the wait times and accessing care. So emergency care is always free and available, but the wait times does depend on severity. So let's say, for instance, you need to get a surgery, but depending on the severity of it, they can speed it up and you can get it immediately. So family doctors do provide general medical care, but there's a shortage, so you have to wait to find one, and this wait time could actually take a couple of months. When we just landed, it was very difficult to find a family doctor. Walk-in clinics are an option and are accessible free with your health card. What about seeing a specialist? You need to get a referral from a doctor, which I just explained. Getting a doctor is very difficult and it takes a very long time. But when you do get a doctor and you need to see a specialist, the wait times to see that specialist could take months, even to up to a year. Well, that brings us to the end of today's video on healthcare. Let me know what your thoughts are, and if you have any further questions, comment them down below, and stay tuned for the next video.